Hi everyone, this is Dr. Kusuma from Suria Cosmetic Surgery. This is again a very informative educational video about neck surgery. Platysmaplasty is the specific term that I want to further clarify with you, because neck has a lot of components. Neck is done with facelift, sometimes without facelift. People have a lot of questions, can I just do the neck? But I want to specifically go over some components of how I address in generally younger patients if there's issues with the neck only. I just posted something on Instagram I think a couple of days ago about an outcome on a very young patient who had a lot of extra neck skin and fat and fullness and wanted more definition, and that's what triggered me to do this educational video, because there's a lot of confusion and neck lift can have a lot of different components. So what are the issues if one were to look at in a young patient that can require some neck contouring? There's superficial fat. Essentially, the superficial fat is fat directly underneath the skin. So if there was to be an opening in the skin and open up, you'll see yellowish color, and that's the superficial fat. Deep to the superficial fat, there's deep neck fat. So if you look at somebody's neck who's a bit older, I don't think I've developed it because I'm such a young person and I'll never get old. But in the center of the neck, if you see in old patients, you can see two bands that kind of come down like this. Okay, and from the sides they're visible, from the front they're visible, they're more visible like this, but there's two very prominent bands that you get as you age, and those are these bands that I've represented here. These bands are the inside central, or what we call medial edges of this muscle called the platysma muscle. There's one on each side. So this comes and attaches here. This kind of continues on into the face, but I'm just showing you the neck component of it. So the medial edges or the central edges of the left and the right muscles called the platysma is what gives the band. And as we age and the skin loosens and we lose fat, the muscle loosens up and loses tone, it basically creates that look of a band because it's attached to the overlying skin, and those bands are ugly and they just stand out. Every time you wear anything nice, it just shows there and it's always there. And so that's the platysma. In between them, they're not fused necessarily in the middle. At the young age, they're a little bit fused in the center, but as you age, they can separate or widen, and especially at the bottom, they're widened. Underneath it, there's this globules of fat called the deep neck fat. Okay, so there's superficial fat and there's deep neck fat that I just talked about. Deep underneath here, underneath the platysma, there's also glands, spit glands, that sometimes in some cases are a problem. As a head and neck surgeon or a former head and neck surgeon, I used to go remove that constantly because of cancer or stones or whatever, but in elective surgery it's rarely needed, and if needed you can go remove it if necessary. But for the most part, the deep neck component of the fat is just the fat that's in the center part between the two bands that come up, and that also has to be addressed. So that's the deep neck fat. The neck bands we just talked about, and there's skin laxity also that can happen with aging. And how do you do all of this with incisions in the neck that are well hidden? Okay, so I'm only focusing on, this is an operation, this is something that is generally for younger patients from their 20s to maybe 50s if they don't have a lot of skin issues or other issues. But this is for that because they're not ready for a full face or face and neck surgery. They have big full necks and they want that reduced, and that's what I'm going to go over. And of that, I'm going to specifically focus on a platysmaplasty. So if a young patient goes to a surgeon to say, how can I get a more defined neck? I just have so much excess fullness in the neck. Okay, so what is the common response that you get? Well, you could do liposuction. This is the number one thing probably people are going to tell you to do. Or they tell you inject Kybella. Or maybe some people say threads. But this is not good for excess fat anyway. So maybe these are the two options that people will tell you. And I'll tell you personally, liposuction alone, in my opinion, and others may disagree, which is again fine because it's plastic surgery. If you do liposuction on somebody as a solo standalone procedure, it's a good technique because you're going to remove the superficial fat only. You cannot take out deep fat in the center part of the neck with liposuction alone because it's behind these muscle bands, like I told you, and you cannot put your probe through there to liposuction it out. It's impossible, and you should not do it, right? And you cannot do it technically either. So superficial fat is all what you're removing. And so what's behind the fat, like I told you earlier, the muscle, platysma muscle, and the bands. So when somebody has a full neck, the fat is camouflaging and covering up because there's a separation of the muscle from the skin, as there's a big buffer of fat between, right? So you go and do liposuction to give them definition, which will give them definition clearly because you're removing that, but now you're exposing the deeper bands and the platysma muscle because it doesn't have that camouflage anymore. So very soon after you do a very solid liposuction on a patient, they're going to come back with the bands visible that are equally bad looking as opposed to having the fat and fullness. I'm not saying it happens to everybody, but I've seen and corrected or improved that look on people who have come to me because they have had liposuction and now they're young and they have these prematurely sagging skin and the bands because the skin didn't contract, and moreover they now are stuck with these bands that are very visible and ugly, so they don't like that either. So I typically avoid doing only liposuction in patients. What do? I do 4 things in this case. I do open liposuction, then I do deep neck fat removal, then I do a platysmaplasty, and I also do Rejuvenation J plasma. So let's go through this individually. So when somebody comes to me with a full neck, I don't do this alone. I do these 4 things, and I recommend that we do these 4 things. The first one is liposuction. What do I mean by open liposuction? So this represents an incision that is made underneath the chin, right underneath the chin. If you look at me, this is the front of the jaw, my face. Underneath the chin, everybody has a little crease. So we make about a small 3 centimeter, 2 centimeter incision underneath the chin right there. Through that opening, I put my cannula, which is a liposuction, lipocontouring cannula, and kind of remove as much fat as I can across here, all the way to the side to define the face. Sometimes I even go into the face over the jawline to define that better. So that's the first step that I do, what we call an open liposuction. And I do this with a power-assisted device called a vibrosat machine that vibrates back and forth, so it makes the passage much, much smoother and easier, so you don't have to use any force to get there. So that's the first thing. The second thing, since I've opened this up, now I have direct visualization of the central neck fat, the deep neck fat. I carve out all of this fat and remove that as well, as best as I can. Okay, that's the second thing. The third thing that I do is I unify the bands into one band, and then I make sure that that is low enough that it creates a very nice contour of the neck that creates the tightness, that kind of paste against the underside of the neck, so it doesn't have those 2 bands that are separated. So I unify them, which is what is technically called a platysmaplasty. Platysmaplasty, you could also say, well, fat removal is part of it too. Yes, it could be part of it, but technically platysmaplasty is just unifying the platysma band in the center with some contouring around it so that the unification happens properly. In some cases, I do something different with the bottom platysma, but we don't need to get into too many technical details for that, but essentially that's what is a platysmaplasty. The last thing that I do is Rejuvenation J plasma. And Rejuvenation J plasma is a radio frequency based device that generates a lot of heat at the end of the probe that I use the same access point to carve out and improve the lower part of the face and the jawline, and also the neck skin that I've just worked on. So the J plasma Rejuvenation device causes the skin to contract to some extent because of the heat that's generated. So now all the fibers from the liposuction that are there shrink down and kind of pull the skin with it with the contraction to kind of go tightly against the neck. Okay, so there's 4 things that are done. Well, you can certainly ask a question, if you just do liposuction alone, why does it get better? It gets better because the skin contracts if you remove some bulk underneath the skin, whether it's in the face or the abdomen or wherever. But it may not be enough to get a nice tight look. So this is an adjunct that you add to the liposuction, lipocontouring, so that you add an additional component of skin contraction that you're forcing the body to do because of the intervention with the Renuvion J plasma. So essentially, I'm doing 4 components all through a small incision underneath the chin to get the best outcome possible, and also to prevent the premature exposure by doing liposuction alone of the neck bands and the platysma muscle that also looks equally bad at a very young age, which is not an attractive look. So we're doing preventative, proactive things and also being extraordinarily thorough to get the best outcome possible. This procedure is probably not the best thing to do with somebody who has a lot of loose skin and older, in their late 50s, 60s perhaps, because they just have a lot going on. They have too many jowls and too much extra skin. This is not a good procedure for them. But younger patients in their 20s to 40s, 50s who have heaviness and fullness and want better definition, this is a very, very good procedure that I do to improve it, and the outcomes are quite good. And if you want to look at them, we can post it and we can give a link to it perhaps, so you can see on the Instagram page of what that looks like, because I just posted it a couple of days ago. So those are the various components of a platysmaplasty specifically that we talk about. But for me, it's very, very specific, very, very thorough, and very detailed. I hope that helps. Thank you so much.